Welcome to our healthcare new student orientation career pathways presentation. I'm sorry we got started a bit late. We were having a little bit of technical difficulties, but we're here now. So I'm glad that any of you who are there were able to join us and stick around until we got started. So let's go ahead and jump right into it. I am Morgan Matlock. I work for the Continuing Education Department at CTC, and I oversee a lot of the healthcare programs here at the college. So hopefully I can answer any questions that you guys might have. I'm going to go ahead and share my PowerPoint now. All right. So who knows what the fastest growing industry in the US is? Obviously, since we're talking about healthcare, I'm going to give you the healthcare information, right? So healthcare is the fastest growing. Across the 100 largest metropolitan areas, the healthcare industry accounts for more than 1 in every 10 jobs. That share varies from just 10% in Las Vegas to 20% in McAllen, Texas. Our healthcare programs are designed to give you a wide variety of skills. There are two kinds of skills to think about when looking at future careers. Hard skills show you that you're great for a specific job. Nobody is born with hard skills. Some examples are coding, taking blood, budgeting, and mixing drinks. Soft skills prove that you'd be a great fit anywhere. They're a part of your personality, but they are also something that can be developed. Some examples include interpersonal skills, communication, and leadership. So the big question is, why you're here at New Student Orientation, you're going to colleges, what do you want to be? What skills do you need to have to do that? And what skills do you need to learn? CTC is home to several programs that can help you find a job in the healthcare field. Healthcare is a vast field that covers different aspects of addressing illnesses, physical and mental trauma, emergency care, as well as care for the weak, elderly, disabled, and children through analysis, administration, record keeping, research, and preventative practice. Here we're going to watch a little video about the nursing department.
Morgan, can you reshare the screen and make sure that you select so that we can hear the audio, please?
Sorry, there's two that are going.
We don't hear him at all, either one.
You don't hear either one?
Mm-mm.
Okay. Hold that thought 1 second and let me double check that it is shared with the video and editing. I did share it with that, but let me just double check it. Okay. I'm almost there now. I've got it. Apologize for the delay. The video should be coming up now, and you should be able to hear it in just a second. Are you guys still there?
I'm here. It's Julie.
Okay, good. I just want to make sure I'm not all alone. All right.
We got your back.
It's coming up now. And there should be video this time. I'm not sure why, but it is not playing the videos now. Should I continue to try to access the video or should I talk through the programs?
Go ahead and talk through them then.
All right, I'm going to reopen the PowerPoint without the video. All right. Okay, well, unfortunately, we have some, well, not unfortunately, we have some amazing videos that unfortunately do not look like they're going to play, and I'm not really sure why, but we just did a test run and they work, so I'm really sorry you guys aren't going to be able to see those, but if you want to reach out to us after this, we can definitely send you those videos so that you can get access to the information that's directly in them. However, I'm going to talk to you first about the nursing program. So CTC's nursing programs prepare students with the knowledge, skills, and hands-on training to work in a variety of settings, including hospitals, physicians' offices, home health care services, and nursing care facilities. With experienced faculty, state-of-the-art equipment, and a simulation hospital, students are exposed to many avenues of learning. We have lecture, online, and blended formats. And as a registered nurse, you will provide and coordinate patient care, educate patients and the public, and provide guidance and emotional support to patients and their family members. As a licensed vocational nurse, you will provide basic nursing care and work alongside registered nurses and doctors. So as a licensed vocational nurse, our certificate program lasts 12 months, and then once you become licensed, you have the opportunity to make an average of $43,000 a year. And as a registered nurse, you will take 2 years of the associate's degree program plus the required prerequisites, and your average wage will be crazy $71,000 a year. And that's average. You could be making way more than that, depending on where you're living, or you could make a little less depending on what you want to do. We also have a fantastic EMT paramedic program here at the college. The Emergency Medical Technology EMT program is designed to prepare students to deliver emergency patient care in the pre-hospital setting. Central Texas College has been preparing individuals to enter the field of pre-hospital care since August of 1983. CTC offers only one of 51, we offer one of only 51 accredited EMT programs in the state of Texas. The EMT program is offered to qualified candidates seeking a career in the EMS profession. Upon completion, students are eligible to take the exam to become certified EMTs, advanced EMTs, or paramedics through the National Registry of EMTs and the Texas Department of State Health Services. So as an EMT, you go to school for 1 semester for the basic program, and you will add an additional 2 semesters for the advanced program. Once you graduate, you will get an average of $34,000 a year wage. Paramedics, they have a little bit more education. They have 4 semesters, but they're going to make another $10,000 on top of that average wage. So mental health. This is a really great department here at the college. I love all the people that work in this department. The CTC Mental Health Services Department offers associate degrees in chemical dependency, at-risk youth, an associate degree in social work with a specialization, and a certificate of completion in community health work. All the programs can be completed online to further their education, during your busy lives outside of the classroom. The faculty are not only credentialed academically to teach, but they bring 75 years of field experience to the program, which is amazing. Students completing either program of study find work in agencies that provide chemical dependency counseling, or in the juvenile justice system, residential treatment settings, community-based after-school programs, and in the public system as teachers' aides. Completion of the social work specialization may be transferable to a four-year school. However, students may still find work in the service areas mentioned above. If you work in at-risk youth specialization, you get an associate's degree and you have an opportunity to make between $19,000 and $25,000 a year. Social work specialization includes an associate's degree and entry-level. You will start at entry-level employment, and your earnings will be between $18,000 and $30,000. Now, if you want to be a licensed social worker, you are going to have to get a bachelor's degree. We also have information on chemical dependency specialization and community health worker certifications. The chemical dependency specialization is an associate's degree. You'll make about $44,000 a year, and the community health worker is a certification where you'll make approximately $30,000 to $40,000 a year. And as a licensed social worker, you have to get a bachelor's degree, but then you can make an average of $58,000 a year. All right, medical laboratory technician, specifically phlebotomy. The most basic definition of phlebotomy is the collection of blood from patients, but phlebotomy is much more than that. Correct specimen collection is essential to good diagnoses and treatment. Without a phlebotomist to ensure proper collection, test results can be altered, and the clues doctors need to treat patients can be missed. Hospitals, diagnostic laboratories, blood donor centers, and other locations will need phlebotomists to perform blood work. A phlebotomist serves patients by identifying the best method for retrieving specimens, preparing specimens for laboratory testing, and performing screening procedures. Research has shown that at least 75% of all medical decisions rely on laboratory data. As a laboratory professional, you will play a huge role in this program. CTC's Medical Lab Technician, MLT for short, is NAACLS accredited, which means you can transfer your credits to any other NAACLS program if you ever have to move. We have a 100% higher rate upon graduation for students staying at Central Texas, as well as a 100% pass rate for the ASCP board certification exam. MLT classes cover a variety of subjects, from introduction to clinical laboratory science, clinical chemistry, clinical microbiology, hematology, urinalysis, immunology, molecular, parasitic, transfusion services, as well as 760 clinical hours, which will help our students master the field of clinical laboratory science. I'm just going to go out on a limb right here and say I did a really excellent job reading all those medical words just now. So as a medical lab technician, you'll need to get an associate's degree, and your average earning is going to be between $31,000 and $41,000 a year. And as a phlebotomist, it is a certification program, certificate program, so you actually will go to school for one semester, and then you will be ready to go to work as long as you pass your exams, and you can make upwards of $20,000 a year. Is another program that we offer at Central Texas College. Histologic Laboratory Technology, HT, is the study of microscopic anatomy of cells and tissues. Histology is an essential tool of biology and medicine, since accurate diagnosis of cancer and other diseases usually require histopathological examination of samples. Successful clinical laboratory students should have strong interest in science, anatomy, physiology, and genetics, and excel at tasks requiring attention to detail and problem-solving capacity. HT classes cover a variety of subjects, including histology, histotechnology 1, 2, 3, functional histology 1 and 2, immunohistochemistry, and Cytology. The program involves 760 clinical hours, which will help our students master the field of histology. I do want to add a note outside the boundaries. All of the programs that we have discussed so far have been very focused on patient care, which is those soft skills, being a people person, being kind, being caring, compassionate. This histological laboratory technology degree is, you always need to have soft skills everywhere you go. But for the person who is less of a people person, this is definitely a good job to consider, because you're going to be in a laboratory. You're going to be working with specimens. You're going to have detail-oriented work. It's something you definitely want to consider when you're going into healthcare. Do you want to work with the patients, or do you want to support the patients without being directly connected to them? So histological laboratory technician is an associate's degree with a median earning of $60,000 approximately. Only 3 colleges in Texas have this, and we are one of them. So that's amazing. All right, medical administrative support, billing, and coding. So like we talked about with histology, if you want to work more behind the scenes, or you want to work in healthcare, but the idea of seeing blood makes you queasy, maybe you should consider a career in medical support or coding and billing. CTC offers programs in medical administrative support and medical and billing coding. Medical coding, at its most basic, is a little like translation. It's the coder's job to take something that's written one way, a doctor's diagnosis, for example, or a prescription for a certain medication, and translate it as accurately as possible into a numeric or alphanumeric code. For every injury, diagnosis, and medical procedure, there is a corresponding code. Medical billers take the information from the medical coder and make a bill for the insurance company, called a claim. Medical administrative support professionals provide all the background administrative function support that makes the clinical or hospital run smoothly. So according to BLS, medical coding and billing specialist requires a certification and a degree, an associate's degree. And with that, you can make approximately $32,000 a year. Medical office administrative support also is an associate's degree, and you can make a very similar amount of money. And medical documentation specialist is a certificate, which can lead to associate's degree right around the same financial benefits there. Hospital ward clerk is a certificate that also leads towards an associate's degree with an average earning of $28,000. And the medical records clerk is also a certificate, which you can eventually turn into an associate's degree if you pursue your education, with a median earning of $28,000. So, kinesiology, fitness and wellness. The kinesiology department prepares students for many career options by equipping students with academic knowledge and practical experience necessary to work in a variety of recreational and fitness settings. Students interested in working in a movement environment such as athletics, physical education, athletic training, fitness, and personal training would enjoy the kinesiology major. A degree in public health, nutrition, exercise science, or health and wellness can provide the practical skills and hands-on training needed to land a career in corporate wellness. All right, recreational therapists. That requires a bachelor's degree, so you'll have to get your associate's degree at CTC, hopefully with us anyways, and then move on to a 4-year college to get your bachelor's degree. Recreational therapists make on average $46,000 a year. And a physical therapist requires a bachelor's degree plus 3 years of physical therapy training. And that one has a big number on it at $85,000 a year average. Massage therapy. So how many of you have ever had a massage? I still get surprised sometimes when people tell me that they have them, because I love them. And just to do a little plug, when we get back on campus, we do have students who are going to need to go through internships. So you're going to want to touch base with us and make sure you can get on that list so you can get your discounted massage once everything gets a little bit more stable. So let's talk about massage therapy. A career in massage therapy gives you freedom and flexibility. Massage therapists work all stages of life, from prenatal and infant massage to geriatric and hospice massage, and even to animal massage. Massage therapy is found in many healthcare settings: hospitals, chiropractic offices, wellness centers, and nursing homes. They also work in a wide variety of venues, from spas to cruise ships. Massage therapy pairs well with several other professions, from nursing and personal fitness trainers to social workers and counselors, sports medicine, and physical therapy. Use massage therapy as a standalone profession or in addition to other specialties. At CTC, a dedicated team of licensed massage therapy instructors represent more than 60 years of massage therapy experience and bring students a broad spectrum understanding of the massage profession and strong basic skills. In addition to the basics of massage therapy, instructors emphasize massage therapy in healthcare settings such as chiropractic, hospital, and behavioral health. Students learn mindfulness, mind-body skills, and self-care techniques to prepare for a career as a massage therapist. Once licensed, graduates return to take continuing education requirements and further their knowledge and skills here with us at CTC. So a licensed massage therapist is a non-credit certificate program at this time, but it is very close to becoming a credit program. The average earning for a massage therapist is $39,000 a year. Clinical medical assistant. As a clinical medical assistant, you will be meeting people from all walks of life. If you're a people person, this could be a career for you. As a clinical medical assistant, students will be trained to help the physician carry out procedures, care for patients, and perform basic lab tests and administer medications. The clinical medical assistant works in a physician's office or clinic setting. Patients look to clinical medical assistants to help them understand tests and procedures that they are receiving and to ease their fears as they face them. You will have a lot of direct patient access, and your skills, training, and compassion can all make a difference in someone else's lives and in the lives of the people that they know. Medical assistants on average make $31,000 a year, and our current program, it did say 7 months there, but our program is actually now down to 5 months. Oh no, there it does say 5 months. Okay. Certified Nurse Aide. A certified nursing assistant, or CNA, helps patients with activities of daily living and other healthcare needs under the direct supervision of a registered nurse or licensed practitioner. You will work directly with patients and their families. This means you will have the opportunity truly to make a difference in the lives of people in a positive way. Being a CNA offers tremendous job stability because the demand will always be there and will continue to grow. Being a CNA is a fantastic way to start a more specialized nursing career should you choose to do so. The job is incredibly varied, and no 2 days will ever be the same. You will have to deal with many different circumstances, situations, and people. Each of these are unique. As a nursing assistant, you can make approximately $26,000 a year, or as a home health aide, approximately $22,000 a year. Our program is 5 weeks. And now let's talk about veterinary assistant. As a veterinary assistant, you will help the veterinarian and the veterinarian technician in their daily tasks. Students will learn to feed and give water to pets, examine them for signs of illness, disease, or injury, clean and disinfect cages and work areas, as well as sterilize laboratory and surgical equipment in laboratories, animal hospitals, and clinics. While working as a part of the veterinarian team, you'll be surrounded by people who are as passionate about pets as you are. Veterinary medicine is always evolving, and there's always something new to learn. As an added bonus, while you comfort animals and their owners, you'll get to wear extra comfy clothes. Simple scrubs and comfortable shoes are the casual uniform of the veterinary assistant. Veterinary assistants can make approximately $25,000 a year, and non-farm animal takers can make approximately $21,000. The great thing about a veterinary assistant certificate is that our first veterinary assistant program is 70 hours, which are 35 hours that are lecture and 35 hours for volunteer. We have an additional program that is 120 lecture hours after that. If you are interested, you can apply for the Texas Medical Veterinary Association certification for the level 1 Veterinary Assistant, and you can actually take the test here at Central Texas College. So if you are interested in that, please do make sure to reach out with us because we would love to help you get certified in that career. All right, pharmacy technician. As a pharmacy technician, you will help the pharmacist package or mix prescriptions, maintain client records, refer clients to the pharmacist for counseling, assist with inventory control and purchasing, as well as collect payment and coordinate billing. If you're the kind of person who feels restless at the thought of a traditional office job, you'll be glad to know that pharmacy technicians have tactile responsibilities beyond typing data into a computer. The BLS reports that the aging baby boomer population, combined with advancements in pharmaceutical research, will bring more patients and more potential treatments and cures to the industry. Knowing this, it's not surprising that pharmacy technician jobs are expected to grow by 12% through 2026, a faster rate than the average occupation, according to the BLS. As a pharmacy technician, your average wage will be approximately $30,000 a year. All right, and it looks like that is the end of all of the programs that we're going to be discussing today. So I'm going to Can you guys see me?
Yes, we can hear you and see you.
You can hear and see me?
Yes.
Okay, good. All right, so I just want to say thank you to everybody who listened to the healthcare presentation. And if you want to get in touch with us or you have any questions about any programs, I would be happy to point you in the right direction. Please feel free to reach out to me. My name is Morgan Matlock, and my email address is morgan.matlock@ctcd.edu. Like I said, I'm happy to answer any questions, point you in the right direction, and thank you for joining us. And
Before we do that, we do have some people that are making some comments. So if you have any questions, can you please go ahead and post them either on the chat or on the Facebook Live? And I want to see if before we stop, I wanted to go ahead and kind of have somebody who's making some comments, and I wanted to read them real quick. So I guess somebody considers that it's very hard to get into the nursing program. Is it possible for you to maybe address, are you familiar with how the nursing program works a little bit and some of the things that students that are interested in participating that they should be aware of?
I have some basic information on that I could provide you with. So I know that the nursing department it's an extremely competitive program to get into nursing. We have hundreds of applicants that apply every semester, and unfortunately, we only have the capacity to educate a certain number of students in each group that goes through. So what I would say to you is, when you are doing your prerequisites to get into nursing school, you want to get the best grades that you possibly can. And I would also like to add to that, it's not just about getting A's and B's. If you are in a class with 10 people and all of you have straight A's, but you have the highest of the grades, like numerically, you're going to get the highest grade, you're going to be the one that gets in. So it's a competition all the way down to that last grade. So you want to make sure that you are getting the best grades that you possibly get into. I know that there are other things that are included in the application that probably hold a huge weight, but I don't know what specifically those are. If you want to reach out to me, I can connect you to the right person in the nursing department who can answer those types of questions for you.
I'm pretty sure, and I know that the HESI is one of the big ones. The HESI test is one of the big things that a lot of individuals are interested in or have to use to be able to get into the nursing department. So that's another thing that they take into consideration. If you are interested in going into nursing, the one thing that you have to do is have good grades. There's, the higher the grades, the better when it comes to GPA, and especially in those anatomy and physiologies, chemistry, and the sciences that are considered prerequisites. Those are the main things. Let me see. I have, is there a practice HESI test we can review? Are you familiar with that? No, I am actually a little bit. There is a practice HESI test through the Office Technology. It's not Office Tech, it's through the Kate Center, I think it is. There is something, and I know when we, I can get you some information on that, but we do have a HESI test, and I really recommend that you do oversee that, or you try that out before you go out and pay money to take a full test. That will give you a lot of really good information. And then I have a person here who wants to know a little bit more information about the EMS program. I'm not sure exactly what he's looking for in the highlight or what the questions might be. But let me see if I can bring up, let me see if I can try to at least show, I'm gonna try to see if I can't show that EMS video, and maybe if I share it, it'll work. We'll see.
Okay.
But do we take credits from other colleges when it comes to nursing? I don't know if you know that answer.
I don't know the answer to that, but I would think it would depend on if the classes were a comparable match. I don't think there's a policy that says if they're a comparable match that we can't accept them. I have not heard that.
So it depends on the college or university they took it at, pretty much.
Yes, it depends on the level of course that they took at the different educational institution.
Let me see, and this is EMT. All right, I am going to attempt to share my screen, and maybe this will help the one person who's interested in. Wait, could you hear it?
Yes, I could.
Okay, I couldn't, so I wasn't sure if you could. Okay, good. I'm gonna go ahead and do that right now.
I do really enjoy the chance of diversity of people we get to meet while doing our clinicals and ambulance rotations. It's fantastic to learn as much as you can in the classroom, but with the opportunity CTC provides you to go and have patient contacts, have contacts with other medics, nurses, and doctors. It just gives you an overall range of experience that I think you can't achieve while you're in the classroom.
The EMT Basic course allows you to go to school for 1 semester and obtain your EMT Basic certification, which is the lower level of certification for emergency medical services. The paramedic certification is over 12 months and allows you to practice that advanced level of care as a paramedic in the field. So once you obtain your paramedic certification, you can actually work for ambulance services, you can work for hospitals, you can work within the prison systems or for police departments. You're able to work for private EMS, or you're able to work for fire departments all over the country. And the best thing about it is it's actually a national certification, so you can stay in the state of Texas, or you can travel outside of the state of Texas and go anywhere in the United States. We have so many opportunities, whether that be clinical, lab, or instructors, that we can really ensure that our students are not only successful within the course, that they're going to have successful long careers in emergency medical services because they're well prepared for everything they're going to see.
So hopefully, let me see if anybody else has any other questions. Let's see. All right. So, okay, that I got. Thank you for the person asking about EMT. I hope that helped you answer whatever questions you had. If you have something specific, please let us know. If you have, I have somebody asking about transfer credits and who is the one who evaluates the transfer credits. she has submitted all transcripts and have not heard back. Are you familiar with transfer credits at all?
I really don't work with that at all.
Okay, so it's my understanding that we do have to get your official transcripts from your school. So if that's definitely a good step. And then the academic advisors can help you figure out unofficially if those classes will transfer or not. We do have an official evaluator in that evaluations department. And usually you have to take 2 classes with CTC to be able to get officially evaluated transfer credit. However, a lot of times if you talk to them directly, they can give you an idea as to whether or not the classes will transfer based on the college or university, the kind of accreditation that they have, and all of that. They might be able to help you out, at least give you a general idea. I recommend, and I'll post those to the person who has questions, that you contact to an academic advisor and also to the evaluations team, and I'll go ahead and post those to you in a little bit. But those are really good questions because we do have some individuals that want to transfer in, and so those are the 2 departments that I recommend that you speak to be able to get that as an answer, answered. So really great questions. Thank you. Let me see if I have anybody else here that I haven't. I'm transferring. Okay, financial aid. I know that this is not what Morgan knows about at all because usually your programs do not accept financial aid. Okay. I know that right now we have really a lot of people that are trying to get a hold of the financial aid department since classes are about to begin next week, June 1st for the summer. And then we also have on June 1st, we're opening up all the fall classes for registration. So I am sorry that things are getting back. Live chat is usually the best way to get through. But if you will send me a direct message through Facebook, Jacqueline, I will try to see if I can get somebody to contact you. Please make sure you include your contact information in the direct message. I think those are all the questions that we have had so far through Facebook, and I don't see any coming in through the WebEx. So I think I think that's all we have for today, but I really want to say thank you to everybody, and especially Morgan, for being able to help us out today and answer a lot of the questions and do the presentation. I have Cody, you are starting EMT, I think. Wait, I have another question. Somebody just came through. I'm not sure if you have the answer for this, but I was advised that we are going to be CPR certified in class. Do you know when this will be? Just asking due to the pandemic that's going on. A lot of that stuff right now is up in the air. Do you have an answer to that?
I have a tentative answer. We are currently in the process of sending up a proposal to do small group classes for CPR for the nursing department. Once the classes are official and scheduled, we are going to send out information to the nursing department, and they are going to push it down to all of their students. So any students that need it will be able to get it. I don't know what the timeline on is. It's probably going to be July when we start having the class. Do our best to get you certified as soon as possible and get that opportunity back out there for you. So we'll let you know ASAP.
Great. I'm glad that you have a much better answer than I had. So good. Yeah, there are a lot of these programs, just so that you know, the administration is working really hard to find a balance between making sure that you're academically going to have every opportunity that we've offered in the past and make sure that you're going to be safe. So a lot of things are taking a lot of time to figure out, just because that is a very difficult balance for us to be able to find right now. But to the administration's credit, they really just want everybody to be safe, faculty, staff, and students. So we ask that you have a little bit of patience with us, just because we're trying to do everything within our power to help you find answers, and at the same time keep you and everybody else safe. So thank you.
And we are also doing our best to figure out how to get you hands-on skill labs on the classes where you need them. We're not there yet, but we are very close.
So hang in there. We're working on it. That's pretty much the answer. Hopefully by July, we'll, at the very minimum, we'll have some more concrete answers. If not, at least be able to get you into class. So thank you. Thank you for the question, because that is something that a lot of people might have doubts on. All right, with that, I am going to wrap it up. Thank you very much, Morgan, again. You've been wonderful, and everybody that has tuned in, I really appreciate the time that you have. Oh, sorry, I keep seeing, I just saw somebody else posted something. What time do we start EMT on Monday? Ooh, I don't know. You should look in your web advisor. Your web advisor will actually have information as to when classes are usually set to begin and how you're going to contact. If nothing else, it will also have the contact information for your professor, and you can email your professor right now, and you should be able to hear an answer before Monday. Let's see, is the help desk still taking emails? I don't have access to my student email. Yes, they're taking emails. Definitely go ahead and if you don't remember your password for web advisor or anything like that, you can definitely call or contact our help desk. Blackboard, I believe we have to do it directly with Blackboard, and the information is in the login screen for Blackboard. Chris, about your CPR card and how you're going to get it to us. I don't know. I'm going to guess that you're probably going to have to show some proof at some point, and it might be that they ask you to scan it and send it in, just so that we have something on file. Potentially at some point they may ask for you to provide the actual card, but that's something that each department, that the nursing department is going to have to inform you, because they're the ones that are going to keep that on file. All right, I am really wrapping it up. Thank you very much to everybody. I really appreciate it. Thank you, Morgan. And please join us again. We're going to be having, next is going to be the STEM group, and that is going to be at 1:30. So please tune in and see you soon.